ACE inhibitors, what you commonly come across, Ramipril, Lisinopril, kind of those things. Here remember that the side effect of cough is not duration dependent or dose dependent. Why it happens? Angiotensin converting enzyme, where it acts? It acts upon angiotensin 1 to 2 conversion. Second one is this enzyme controls, means it degrades tachykinins and also bradykinin. So this nociceptive substance bradykinin, which can lead to edematous mucosa, they can induce the cough. Stop this ACE inhibitor. So after a period of 4 weeks, cough will be gone. If not so, suspect other etiology.